Today I want to talk about 5 biggest mistakes made during graft extraction in hair transplantation. 1. Using the same standard punch for every patient. In my opinion, using the standard punch for every patient is one of the biggest mistakes. I will tell you why. Because every patient has different hair thickness, skin characteristics, follicle structure, and graft anatomy. I know that many people see online very small hair punch size, and also they assume that smaller is the better, but actually it's not true. Yeah, in reality it's not always true in terms of the punch size, because if the punch size is too small, it means that the transection rate can increase. Also, supportive tissues may be damaged and the grafts can become much weaker. So as we understand here that the goal is not using the smaller punch size, the goal is using the safer and more suitable punch size for the patient's hair thickness. Second, aggressively harvesting multi-hair follicles. Another important issue is that which hair follicle is going to be extracted. Because in the donor area, we may see single, double, triple, or even quadruple hair follicles. The clinic, you already agreed, may focus more multi-hair follicle grafts to extract. I understand in very short term it may collect large amount of hair follicles to give you the good result. But in the long term, the donor area may become depleted much faster than you expect. So here I mean that it's not always about to take the strongest grafts you see during the extraction. Sometimes it is important to keep the balance, preserving the donor area and the hair transplanted area. The third, over-harvesting in the certain area of the donor area. In hair transplantation, it's not important to take maximum number of grafts all the time. The more important thing is that make homogeneous look after 1 year of the hair transplantation. Also, I know a lot of patients that they're concerning about their donor area under the light conditions, which is very easily noticeable. So it might make you sad too. 4. Causing excessive trauma in a very simple graft. I will explain you how. A hair graft is not just a hair shaft. Around the follicle there are protective tissues, microvascular structures, connective tissues, and supportive fat layers. If excessive trauma occurs during the extraction, survival rate may decrease, and also the hair may grow so much thinner than they expected. Even they might not even grow. You are waiting very large amount of number of grafts from the extraction and for the implantation, but the real question here is how healthy these extracted grafts are biologically safe. The last mistake is focusing on the number of the extracted grafts, because what I recommend you is that the plan, how it's gonna look 10 years later, or how the donor is going to look, and how these extracted grafts are distributed are much important than how many numbers of grafts are extracted. So I believe that patients should focus not only how hairline is and how many grafts are extracted, but they have to focus the technical philosophy of the hair transplantation surgery. Because sometimes the details you don't see mostly determines the result of hair transplantation.